Hi everyone, this is Andrea, and I worked together with Diego on the term proposal. Diego, do you want to introduce yourself as well?
Hello, my name is Zach Navarro, and we're going to be presenting a little of the research proposal for you.
Okay, so the topic we choose was MEMS for seizure prediction. And more specifically, we try to narrow the field to epilepsy. Epilepsy is a common disease that affects millions of adults and children in the world, and it consists in a condition where the patient can experience random and like very hard to predict seizures that can lead to serious damage and also death on occasion. And the way these seizure affect the patients is basically when the brain constantly sends signals to the muscles, electrical signals that give commands, such as move your arm or whatever. And these signals have a certain frequency, and whenever the brain is operating under that frequency, then in the body can handle the signals and react well to it. But if the frequency is increased, like during a seizure, where the frequency of the signals gets increased by 6 times the normal amount, then the patient goes in shock and he can't control, he or she can't control his muscles anymore. So, and this is dangerous. Obviously, this condition is dangerous and can lead to death. So what we have noticed that in the modern world, most patients rely on the help of practitioners, of doctors, but obviously the doctors are not available all the time to assist these patients, and also the machinery, the technology that is used to assist these people is very expensive, and to run these tests it requires special equipment such as the electrocardiogram, or more specifically, the procedure is the electroencephalography. And these procedures, uh, as I mentioned, require someone that has the expertise to read the results and perform the test. So our proposed solution, our objective for this paper was to try and find a solution that would involve the use of MEMS and would kind of like provide a wearable device that would contain MEMS devices, and could potentially help by predicting and by analyzing these signals and receiving them, analyzing them, and create patterns. These signals create patterns, and these patterns can be analyzed by obviously by a computer, or artificial intelligence neural link. So basically our device would take these signals, send them to an external machine, and then this data would be elaborated and could give the patient some alerts, some daily, or like some live updates on their condition. And if the patterns get studied show that the patient is gonna have is gonna have a likelihood of have a high likelihood of having a seizure, then they could go to the hospital, or contact their doctor, or take their medication. And that's basically uh, what we based our project on. Now Diego is gonna talk about the fabrication steps, and more in depth on which type of MEMS we decided to pick and choose.
So, the device that we found to be the better option for this issue was a dry electrode, which is a microfabricated technology that is in a needle like shape that can be inserted under the patient's skin. This allows to read the electrical impulses from the brain. And as Andrea mentioned earlier, the seizures are a series of impulses at high frequencies. So obtaining this information, it's extremely important to the in the process of predicting seizures. Also, the tip of this device measures around 20 micrometers, so it's very efficient to pierce human skin. However, it needs to be inserted in a hairless area of the head. For the fabrication process, we reference to a paper named Using Novel MEMS EEG Sensor in Detecting Drowsiness Application, where the authors mentioned that to obtain a needle-like probe with such a high aspect ratio, this means the ratio of the depth to the surface area, they had to develop a process that consisted of isotropic and anisotropic reactive ion etching. And later they had to also develop a technology, electroplating technology, to make the tip of the device conductive. So the fabrication process would have to be done in two stages, with the first one being the dry etching, where we would get the high resolution and high aspect ratio for the needle shaped probe, and the second one would be the wet etching, just to release the protective layer of the hard mask. With all of that, our proposed solution would be a device, a wearable device that connects wirelessly to the electrode, to the dry electrode that's inserted in the patient's head, and the signal, the data obtained for the dry electrode is sent to this wearable, similar to what already exists for diabetes devices, where they keep reading and let the patient know when they need to take actions and to predict any imminent seizures. In other words, this would be a mobile version of an electroencephalography exam where the patients can carry them and predict the seizures so they can take the actions before it happens.